my name is Catherine Corrales. I'm going to be showing you how to insert an RGP and how to remove an RGP. The first thing we're going to be doing is we're going to be washing your hands. Now, it is very important to use lotion-free soap and lint-free towel. For what is the reason? We don't want any lint getting into our fingertips, so when we touch the contact, we could get into the contact and into our eye and simply cause infections. Now, once we wash our hands and we are done with the first step, we're going to be placing the RGPs into our eye. First, we're going to get to RGPs and we're going to put it in the middle of the palm of our hands. We're going to be using our BioTrue, and all we're going to do is pour some on the contact and just clean the contact. We're going to center out, center out, center out, center out, flip it, same procedures, center out, center out, center out, center out. It is very cautious to use this method because if you go in a circular motion, you're going to break the RGPs and you could crack the RGPs and then we won't be able to use the contacts. Now, once you are done cleaning the contacts, you're going to put the contact in the index of your finger. You're going to take your left hand, pull your lashes all the way up, and with your middle finger, you're going to pull the lower lid down. You're going to simply place the contact in the middle of your eye, and you could blink a little bit so your contact will go straight into the middle. Once you've done that, we're going to remove the contact. We're going to use the scissor method. We're going to get our left hand and simply grab the corner of our eye and move it temporary. We're going to have our hands in a little cup and we're just going to look down, push it temporary, and do a hard blink and it falls down. Now, to put the contact in the solution, we're going to be doing these few steps. First, we're going to clean them. We're going to be using our Boston Advanced Cleaning, which is this right here. The red cap simply means to avoid in the eye. So make sure you get all of the cleaning soap out before putting it into the case. So we're going to put it on the contact and we're going to center out, flip it, center out. Then to wash off the soap, we're going to be using our BioTrue once again. Don't be afraid to use the entire bottle to clean the solution because it is very cautious to clean the soap out. We're going to put the BioTrue there and simply again, center out, flip it, center out. Now to store the contact, we're going to be using our Boston Advanced Conditioning. And all we're going to do is we're going to be putting it in a little case. The R is for the left side, the right side, and then L is for the left side. So what we're going to be doing is we're going to open it. Then we're going to be pouring our solution in there. And once it's there, we're going to place the contact and close the case. Please be aware that it should have a backup glasses in case your contact breaks or you lose your contacts because you don't want to be without anything in your eyes. Also, be aware, if you feel like your eyes are really irritated, if they're red, excessive tearing, if you feel discomfort, please remove your contacts. Don't keep them on and go see a doctor if it gets worse. Another thing to be aware of is you can't sleep with the contacts. You can't go to the beach, the pool, and you can't sleep with them at all. Don't extend them. Don't share them with anybody else. One thing to keep in mind is that if you're going to wear makeup, please put your contact on first and then do your makeup. Same thing with removing it. You're going to take off your contact and then you can remove your makeup. Also, please be aware that these contacts are annually. You will have to replace them every year. Don't extend them for 2 years or 3 years, only annually. For first-time wearers, also be aware that you're only going to use it for 4 hours today. So, for example, today you use it for 4 hours, tomorrow 2 hours, which would be 6, and the next day another 2 hours, which should be 8. Once like that, you're going to get used to it, and then you could use them the entire day. Do you have any other questions?